Hi, I'm Dr. Sandy Baird. I'm an injury rehab specialist with over 10 years of treating plantar fasciitis pain. Now, over my time, I've seen a lot of treatments come and go. Today, we're going to be talking about the Graston Technique and whether it works for plantar fasciitis. Now, I'm going to be showing you how it works, and I'm also going to be talking about why, if that's the only thing you do, we're going to limit our effectiveness in treating plantar fasciitis. So hit that like button, stay tuned. Research published in both the Journal of Orthopedic and Sports Physical Therapy, as well as the Journal of Manual and Manipulative Therapy, has shown that a multimodality approach is best for treating soft tissue injuries. That is, manual therapy has moderate evidence, exercises have good evidence, joint mobilizations and manipulations have good evidence, but when you combine one or more of those modalities, you get strong evidence for its effectiveness. It's a bit of an outdated myth that we're actually breaking down adhesions when we're scraping tissues with the Graston tool. Honestly, it's a little bit more complicated than that. It involves neuromodulation via the nociception system, which is basically allowing a patient to feel a less strong perception of pain. So things are going to feel like less painful, they're going to feel less tight, it's going to feel better, but we're not actually breaking down the adhesion. There are some local tissue changes that can be visualized on MRI studies. Specifically, I'm talking about the viscosity of certain types of fascial planes and fascial layers of the tissues. So I still use the terms breaking adhesion or releasing adhesion, as that's still the common understanding, and it does make it easier to talk about it. But anyway, if all we do is scrape through the tissues and create this changed pain perception, and maybe we get some local benefits also, like some increased circulation, but if that's all we do, we're going to be limited in our effectiveness. Now, it may be something where if you've had the injury for a week or two, it's just starting to come on, we may be able to do some scraping through the tissues and just resolve that injury. But more likely, this is a more chronic, more long-standing injury that's been going on for weeks to months, and it's going to need just a little bit something more. We may still be able to make a lot of progress with the Graston technique, but we're going to limit our effectiveness if that's all that we do. For one, the tissues on the bottom of your foot didn't just become tight and inflamed by themselves. It's not like you stepped on a rock and you're having a local tissue response. It's more that things have come on insidiously, gradually over time, and we're locked into a more chronic condition. So what's more likely happening is that one of the joints throughout your feet are stuck, not moving properly. Either you have decreased rotation at the talonavicular joint here, so when we land on the heel and go into pronation and supination, you're not getting that twisting action, or you're limited in dorsiflexion at the talar joint right here. Additionally, you could have an intrinsic foot muscle weakness. So if the muscles within the foot are not able to grip or grasp, you're going to be limited in your biomechanics. Additionally, the issue may be coming from higher up. So maybe the foot's not moving great, but also we're probably likely to find a tightness or a weakness through the hip and gluteal musculature. And when that happens, it's super common for your gait to get out of whack and to have all kinds of compensations down the chain, either in the knee or in the foot. So if we just hit the manual therapy part of this, we're missing out on the benefits of strengthening and stabilizing, and we're also missing out on the benefits of mobilizing or adjusting the joints that are fixated that are contributing to this problem. So yes, the Graston tools and technique do work well for plantar fasciitis. I use them in my office for all kinds of conditions, but I'm also doing a full assessment. We're not just scraping out the bottom of the foot, maybe the calf, and calling it a day. We're figuring out what's at the root of the problem, and then we're addressing that cause. Each person's treatment plan is a little bit different depending on their injury history, depending on their asymmetries, and several other factors. So I would recommend getting a full assessment. If you're in the Oakland Bay area, you can reach out to my office. We can do that assessment here. If you're not local to the Oakland Bay area, please seek out a sports chiropractor or a sports physio that can help you really figure out where the issue is coming from. Don't just get stuck rolling on that frozen water bottle and trying to stretch out your foot all day long. You need more than that, and we'll be able to get you there. And if you're just looking for some place to start, maybe you've got one of those injury types where you've just had it for a week or two, it hasn't really fully set in, and you want to try a little bit of home exercise and technique first to see if you can resolve it on your own, head down there to the description box, click on that link so you can download my free e-guide. It's called the 8 Steps to Fixing Your Plantar Fasciitis. It's got all kinds of exercises, stretches, and strengtheners that you can do at home to get a good start on that plantar fasciitis. If that's not helping, obviously reach out and book a consult, but that's a great place to start. So I hope that answered your question about whether the Graston technique works for plantar fasciitis. Yes, it does, but also it's not the only thing that works. So if you want to subscribe to my channel, you can do that right over here. There's another video over here that you might be interested in as well, where we talk about should you avoid being barefoot when you have plantar fasciitis. I get asked that all the time. I've got some great answers for you, so go check it out. All right, thanks for watching. We'll see you on the next one.